Welcome back to Mayo Clinic Radio. I'm Dr. Jake Strand.
And I'm Tracy McCrae.
If you've ever flown in an airplane and changed time zones, you may have experienced it. Jet lag. Jet lag is a temporary sleep problem that can affect anyone who travels across multiple time zones. Your body has its own internal clock or circadian rhythms that signal to your body when to stay awake and when to sleep.
Mine, I want to sleep a lot more than the usual person, I think.
Of course.
Jet lag occurs because your body's clock is still synced to your original time zone instead of the time zone where you've traveled. The more time zones crossed, the more likely you are to experience jet lag. Here to discuss how to deal with jet lag is the director of the Travel and Tropical Medicine Clinic at Mayo Clinic, Dr. Rizwan Sohail. Welcome to the program, Dr. Sohail. It's nice to meet you.
Thank you. It's a real pleasure to be here.
So, one time zone, two time zones. How far do you have to travel before you really experience jet lag?
So in general, most of the people have to travel 3 or more time zones to experience real jet lag, but occasionally people would experience it after a couple of travel zones as well.
I would say that. Yeah. I definitely notice it after 2. I don't know about 1, but 2 for sure.
Do you feel like, this is the question that I always wonder, with as a parent of young children, but also talking with my parents as well, going from west to east or east to west, does that make a difference?
Yes, it does. And people experience worse jet lag when they travel towards east. And it's primarily because when you travel towards east, you have to get into a habit of sleeping early and then wake up early as well. And it's always easier to sleep late because, you can just scroll through your Facebook or Twitter and stay awake all the time. But it's harder to, start sleeping earlier. You have to turn off your electronics and have limited exposure to sunlight. Mm-hmm. So that's why it
makes a difference.
I would say with your children are so young that when even time zone, or when they not just going from one time zone to another, but when it's we go to daylight savings.
That's right.
You
that early morning, they're up either way. Yeah, they don't have that lucky ability.
So what are the symptoms of jet lag?
So because the jet lag occurs of this mismatch between the internal clock and the external light and dark cycles, people have difficulty falling asleep and then staying asleep. And because of that, they don't get enough sleep. And during the daytime, they have excessive sleepiness. They're unable to focus and concentrate. And that, coupled with the travel fatigue itself, because travel is tiresome, people may experience that they have irritable mood, they have difficulty interacting with others, they get angry very quickly, especially if they're traveling with kids or, other co-travelers. And then they may have difficulty driving or focusing on their tasks. Sometimes business dealings, they may have difficulty remembering things. And it's all primarily because of the sleep that they're experiencing.
So how long can we blame our irritable mood on jet lag, and how long does our body actually get used to it where we should start to feel functioning more normally?
Just in time for the conference to be done.
That's right.
Or the vacation to be done.
Right.
So it depends. If you have planned in advance and have done certain steps to limit the jet lag in advance, then you could be over it in 2-3 days. However, depending on how many time zones you've traveled, if you travel like 8 time zones, it may take your body 5 or 6 days or up to 7 days to adjust. And as you said, conference is over, it's time to head back then. Therefore, it's absolutely necessary to plan in advance and do the preventive things as much as you can to limit the jet lag.
You like the preventive things. I didn't even think about that. So what are some of the preventative steps that you can take?
So there are things you can do before you travel, during your travel, and when you get there. So before you travel, make sure that you're well rested so you don't start off with a sleep debt. Secondarily, depending on which way you're traveling, so if you're traveling towards east, then get into a habit of going to bed early. And that would be, turning things off, stepping away from your electronics, limiting exposure to sunlight in the afternoons.
Getting up at 3 a.m., 4 a.m.
And then, go out if you can, but in Minnesota, you may not have that luxury. So, turn on the lights indoors and have exposure to bright sunlight before you go. And then go to your local store and get some Tylenol PM or occasionally melatonin, and we'll talk about, treatment later on. And Then when you get to the plane, turn your watch to the destination time zone. So during the travel, then try to sleep and stay awake as per your destination time zone. So if you're traveling to Dubai and it's daytime during Dubai, try to stay awake. And if it's nighttime, put your window shades down, put some sunglasses or eye patches on, and avoid drinking excessive amount of caffeine during your travel. And also avoiding alcohol. Alcohol may not help you with the jet lag or prevent the jet lag, but it makes you excessively sleepy, so you may get blood clots in your legs, which would be worse than having a jet lag. And then when you reach your destination, then again, if you're traveling towards east, then try to sleep in early. So limit your exposure to sunlight at that time. Turn off your electronics, go to bed, wake up early, get exposed to the sunlight. And when you're traveling the west, you have to do completely the opposite. In addition, when you get there, try to schedule your meals and social contacts according to the local time zone rather than, with your origin time zone.
Are there some people who are more susceptible to getting jet lag? I would imagine, like you said, if you go into the travel tired, but besides that, are people more susceptible?
So in general, as we age, our body may have difficulty adjusting to the time zone. So in many studies, the older adults had difficulty adjusting. Similarly, women have more difficulty adjusting to the local time zones compared to men, and it's not really clear what the reason is, but this trend has been observed in some of the studies.
Interesting.
Kids, on the other hand, tend to adjust quite well.
We have about 90 seconds left. Could you tell us about some treatments for jet lag?
So the treatments could be over the counter. So you could try Tylenol PM or Advil PM, which has some Benadryl in it and helps you sleep. Then there's melatonin. It's a hormone which is over the counter. And there's a dose range, but usually like 3 milligrams of melatonin. When it's time to go to bed, like whatever that time is, 8 p.m., 9 p.m., you should take it. It peaks a few hours later and helps you sleep earlier and stay asleep longer. And then if these things don't work, you can always ask your doctor for a prescription medications like Ambien or Leonesta or Sonata. We typically advise people to try not to use them because occasionally you can get a hangover the next day, and then that's a difficult thing to
Keeps
deal
yourself from getting on that cycle of the local time zone that you described. That's helpful.
I can just see you, Dr. Strand, at the conference in Dubai, asleep in the front row.
That would be less than ideal. So I'm going to take some of these travel steps, including some of the prevention pieces. I think, again, we look for that quick fix over the counter instead of doing some of these things ahead of time. So greatly appreciate that advice today.
Good. I have a theory that it is harder to go just 1 or 2 time zones than it is to go like 6 or 8 hours. Am I making that up, or is that right?
No, that's a brilliant observation. And in fact, like in some of the studies where they looked at how far people travel, it seems that if you travel more than 8 time zones, you're more likely to adjust to the local times easily compared to 2 or 3 time zones. So you're right.
Because it's a complete flip-flop instead of just a little tweaking of your schedule.
Exactly.
The beauty of tweaking your brain. That's perfect.
We've been talking about jet lag with Mayo Clinic expert Dr. Rizwan Sohail. Dr. Sohail is the director of the Travel and Tropical Medicine Clinic at Mayo Clinic. Thanks for joining us today.
Thank you. My pleasure.